Welcome to another episode of the Longevity Blueprint podcast. Today, I have on as a guest Dr. Betsy Greenleaf. She's a premier women's health expert, entrepreneur, inventor, and business leader who specializes in female pelvic medicine and reconstructive surgery for over 20 years. Dr. Greenleaf is a trailblazer as the first female in the United States to become board certified in urogynecology. She possesses a professional reputation that has led to being sought after by medical societies, associations, and corporations to provide lectures, teaching, and advanced training. In 2018, she was honored with the title of Distinguished Fellow of the American College of Osteopathic Obstetrics and Gynecology for her service and dedication to the field. She holds committee positions on many national women's health organizations. She's a board examiner for the American Osteopathic Board of Obstetrics and Gynecology. She serves as a spokesperson for the American Osteopathic Association, with her quotes appearing in many major media outlets. Dr. Greenleaf is the CEO of the Pelvic Floor Store, www.thepelvicfloorstore.com, an online store dedicated to finding reliable products for pelvic health. She manages a blog at drbetsygreenleaf.com, and she is the host of Sum of Your Parts podcast, dedicated to women's wellness and the notion that you are greater than the sum of your parts. Dr. Greenleaf takes a holistic body, mind, spirit approach to healing and wellness. She believes many of the answers to a healthy life are found within. She views her role in life as your wellness guide. So welcome to the show, Dr. Betsy Greenleaf. Saying obstetrics and gynecology is a little tongue twister.
I know. Thank you so much, Stephanie. I'm so honored to be here.
Well, tell me your story. How did you become an OB-GYN?
It's so funny because I think about that all the time, because that's the last thing that I wanted to do, because you're like, who wants to look at that all day long, And it's funny because when I was in training, I was at lunch one day in the hospital and I'm sitting with one of my colleagues and she was a podiatrist. And I said to her, ew, how do you look at people's feet all day long? And she looked at me and she's like, are you serious? You're asking me this? And I was like, oh, I kind of forgot. But, I think I was always interested in medicine, and I just didn't know, I wasn't the person who went to medical school and was like, oh, I'm going to be an orthopedist or I'm going to do this. I just wasn't quite sure. And as I went through all my different rotations, I started to realize that, oh, I like this, I don't like that, So I was really drawn to some of the surgical specialties, and I actually started my training in general surgery. But I was the person who wanted to talk and get to know my patients and have relationships with them. And nothing against general surgeons, but a really good general surgeon is a body mechanic.
Yeah.
They're not emotionally attached to their patients, because they can't be. They need to get in there, get the job done. Sure. And so I really came down to, I wasn't cut out for that, because I'd be doing my rounds and I'd be like, so how do you feel now that you had your gallbladder out? So, and then I realized really gynecology was really more of where I could have those relationships with the patients. I could do the surgery, I could do the medicine, and it really had much more of an interest in that. So it took a little long way around, but I finally figured it out. So, yeah.
Wonderful. Well, I know you're a expert in pelvic health. So why is pelvic health important?
It's so funny. It's, what I want to do actually pretty soon, and I'm debating how I'm going to go about this, but I want to make a challenge on Instagram, or how you see these challenges that go around, that go viral. I would love to have a viral challenge where people say their favorite pelvic body part, where they just go outside and yell the word vagina, penis. And the reason because is, it's almost like that area, the pelvic area, which is from the belly button to the top of the thighs, it's almost like it doesn't exist.
Sure.
There's Americans in general tend to be, on a whole, we tend to be very conservative. There's a lot of shame about that area of the body part, male and female. And even in the medical field, I'll find that there are certain orthopedic conditions, certain hip issues that can refer pain to the pelvis that people don't feel in their hip. And, as soon as an orthopedic doctor hears a patient say oh, my vagina hurts, then they're like, oh my God, not me, go to a gynecologist.
Right.
So I think that the more we say the words, you become desensitized. Because I was like that too. I was shy. I didn't like to talk about body parts. I mean, my grandmother referred to the vaginal area, as she called it, your business. So she'd be like, I remember being like 5 years old and staying at her house, and I'd take a shower and she'd be like, make sure you dry off your business, so we don't even use the right the right terminology because we're embarrassed. So, luckily my kids, luckily or unfortunately, I don't know which one, they've heard the word so much, it doesn't mean anything to them. They're like, oh, mommy's a vagina doctor. Yeah. So, the more we say the words, the less we're shocked about it. Mm-hmm. And then the more we can talk about it, because 30% of women, no, wait, I get it backwards. 50% of women and 30% of men will have a pelvic health issue at some point in their lifetime.
Wow.
And a lot of people will not, because of shame, embarrassment, they don't know how to bring up the conversation. Their doctors might not know how to bring up the conversation. These issues get ignored and people really suffer with them. They think that they're the only person having these issues, or they chalk it up to like, oh, I'm getting older, this is just part of aging, when there's just so many different things that can be done about, a myriad of issues that are out there. For one thing, incontinence. So peeing when you don't want to, that can start as early as in your 20s. There's people even younger than that have problems controlling their bladder, but it can start as early as in your 20s. And something called urge incontinence, where you have to like run to get to the bathroom and have problem holding it in. By time you reach your 70s, there's more people in their 70s walking around with that than has the common cold. So it is so, and it's from the pad industry, that it's a $20 billion a year industry.
Wow.
So that just tells you how many people are really dealing with these issues.
I'm glad you brought incontinence up. That in the introduction of my book, I talk about how really treating, I don't know if you know this, but I early in my career became a certified continence nurse. So I had found out that the number one reason for admittance to long-term care facilities was incontinence. And I thought, I need to help these patients have a little more dignity and be able to, remain in their homes. And so I actually got trained also as a nurse practitioner and fitting patients for pessaries, those sort of devices. And I still to this day do pessary fittings. It's kind of an art. Not a lot of providers around here do that. But that's what actually kind of cued me into functional medicine, because I thought if there's a non-surgical, non-pharmacological option for incontinence, and a pessary is not for urge incontinence, just to be clear, but then there have to be non-surgical, non-pharmacological options for all other conditions. And it kind of just opened my mind into this functional medicine world. But going back to incontinence, let's talk about some solutions. So even for younger women who are starting to experience this, what is your best advice?
It's funny because I'll tell you, first of all, urogynecologists are amazing. We're all amazing. There's only about 1,500 of us in the country, and we take care of specifically women with pelvic health problems. But there's also men that would see a urologist. But I think when you go to a doctor, and I'm not saying don't go to a doctor, but what we're trained to do and what actually happens in the office becomes two different things. Because a lot of times we get very limited time to spend with patients, and everyone jumps to like, let's do treatment. So unfortunately, I see too many times that people are thrown on medications, told that they need to have surgery, because there's this pressure from the doctors that I need to fix it. But then there's so much you can do before you even get there. And surprisingly, I think the biggest answer to almost any medical condition in life is looking at your diet.
Yeah.
Because we know that, I think, you go back to Hippocrates, who said, let food be thy medicine. And we've gotten away from that in some ways. And now we're heading back to it, where we're looking at the gut and the gut microbiome and how it affects different health systems. So really, there's so many ways in that the gut can actually help your pelvis. Yeah. So certain foods can be super irritating to the bladder. So if you have like urge incontinence, which is like the most common cause, where you're running to the bathroom all the time, you might be eating foods that are irritating you and not realizing it. Or maybe there were foods you were eating your whole life, they were fine, and then all of a sudden now you're developing a sensitivity. So, and everybody's different in this realm, but typically the things that for most people will bother them are coffee, and even decaf. It has to do with the acidity.
Yep. And decaf still has caffeine. People think,
Yeah.
I drank decaf. No, it still has caffeine.
So sodas, so anything carbonated
Yep.
can be very irritating. Tomatoes, which are in your nightshades, those can be very, very irritating to the bladder. Alcohol and chocolate. So like all the good things, you don't really want to go out for like an Italian, dinner with a nice dessert with alcohol, because those are all the things that could potentially irritate the bladder. But we're not saying like stop all those foods altogether. What I usually tell people is I'll give them a list of foods that tend to be, and like start with those, and citrus fruits too.
Yep.
Start with those and cut them out and see if it makes a difference. And if it doesn't make a difference, or if it doesn't make a difference, I mean, ultimately you'd like to cut them out for 12 weeks, but 12 weeks sometimes is really overwhelming for people. So I'll tell them like, just cut them out for 2 weeks and let's see what happens. But if they say you do get better, you can just add the foods back one at a time,
Yep.
and see if one of them bothers you. And you say you've noticed like, okay, tomatoes bother me. Well, it doesn't mean you can't have tomato sauce ever again for the rest of your life. You just go, all right, you know what? Either you go, well, when I eat that, I know it bothers me, or there's things you can do to counteract it. You can just actually drink baking soda in water, like do 1/4 teaspoon of baking soda in 8 ounces of water, and that will neutralize the acidity. I've tried it myself. I can't stand the taste, but I have patients that swear by it. Or there's over-the-counter products called Pre-Leaf, which is pretty much the same idea, but in a tablet form. So you're not having to taste that sodium bicarbonate. So that's probably the easiest place to start. And then the other thing is, this is counterintuitive, but people that have urinary tract issues tend to purposely dehydrate themselves because they're like, oh, I'm peeing a lot, so I'm just not going to drink. Well, that actually has the opposite effect.
Yep.
Because now you're concentrating your urine, and the concentrated urine is more irritating to the bladder. So there's a fine line between drinking a lot of fluids to kind of, ultimately, if you drink and your urine's clear, that's a good sign. And that should be enough that it kind of diluted enough so it's not irritating the bladder. So that becomes like a fine line with that. So
wonderful. Those are all awesome tips. I'll also add to that list dairy. So for some patients,
yes.
Not everyone, I mean, so for some patients, it's the obvious acidity that's causing that gotta go right now feeling. But I've even had dairy cause patients problems.
Yes.
So sometimes they have to remove that. Again, dairy could be irritating the gut, and it's also irritating the bladder.
Yeah.
So those are great tips. What happens to us as we age? So you kind of alluded to this a little bit earlier. As far as pelvic health is concerned, what's happening down there?
One of the problems is it's happening all over the body, but we just ignore the pelvis, is that starting in our 30s, we start to lose muscle mass. And so every year we're losing about 30% of our muscle mass. And it's definitely, if you don't use it, you lose it. But, people go, all right, well, I can go to the gym, I can go for a walk, and that's going to exercise my other parts of my body. And people are like, nobody even thinks about the pelvis until it's too late. And so what those weak muscles can lead to is they can lead to difficulty holding in the urine, holding in stool, holding in gas, but
Sure.
They can also make it so that things in the pelvis start to droop. So for women, the bladder may start drooping, the vagina might start drooping. So really doing your Kegels is the way to work out the vagina. Now, one of the problems with that, everyone goes, okay, yeah, I'll do my Kegels, but a majority of people don't do them properly. They found that women often will push down instead of tighten up. And so I have a really good friend of mine who he explains it that he's like, picture that you're in front of the Queen or you're on national television and you're about to fart and you want to hold in that fart. He's like, those are the muscles that you want to use. And he said ever since he's explained it, like that you're in front of someone really important or you're on national TV, most people are like, okay, good. I know which muscles those are, and they can learn to tighten them. And it's something that we should all be doing, every day if we can, but a minimum 3 times a week. And I usually instruct people like try to tighten and hold it to a count of 10 and repeat that 10 times. Or you can do something what's called quick flex, where you tighten them really fast. You go like tighten, 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 tighten. And you do that 10 times and then you relax. And then you do that repeat it for about 10 times. So, there's some other exercises. I know a lot of people are not necessarily getting to the gym around this time, but even just sitting in a chair and rolling up a towel or putting a ball between your legs and squeezing against the ball, that can also tighten your pelvic floor. So, and get those muscles working again. So yeah, definitely we lose so much muscle mass and it really affects the pelvis.
And that's such a good point. If we want to, I tell patients, at least, if you really, want to be able to lift heavy, you start working your biceps so you can recruit and use that muscle as needed when you're going to go lift something heavy. Same is true with your pelvic floor. You want to try to hold in your urine, but you haven't worked those muscles in years. Well, there's not a lot to recruit, not a lot to use. So we have to be working those muscles. And as you mentioned, I think the pelvic floor gets ignored. We don't think about tightening those muscles. So I tell patients at every stop sign, I'm trying to tell patients ways to remember to squeeze their pelvic floor. So if they're driving at a stop sign, squeeze the pelvic floor. I mean, whether they're brushing their teeth, whatever works for them.
I know I used to tell people like at every commercial on TV, but now we all fast forward through the commercials, So.
But somehow incorporating this as part of the daily routine would be the best thing to do. So you're working those muscles. And if you don't know how, you can certainly see a pelvic floor physical therapist. I know postpartum, I was just like, I know too much. I need to stay ahead of the game. I wanted to go see a physical therapist for the pelvic floor to help me because I wanted to make sure everything was okay and that I didn't end up with incontinence. So very important. What are the risks to the vagina with aging? So other than having a weak pelvic floor, what else can happen?
What happens is as we start getting into that perimenopausal period and menopausal period, our hormones start to change and we get moody, we tend to get hot flashes. But what happens to the vagina is the tissue starts to thin. And this becomes very problematic, not just when it causes dryness or maybe can cause pain and discomfort during sexual activity, but it actually starts to change the pH of the vagina. And so, we talk about the microbiome of the gut, helping with body inflammation, but there's a microbiome in the vagina. And so there's healthy bacteria that likes to live in the vagina, lives in balance, keeps you from getting vaginal infections, keeps you from getting urinary tract infections. But now as we go into menopause, things get thrown off. So prior to menopause, that tissue is nice and thick and healthy because we have estrogen and it's like multiple layers of cells thick. And when those cells die off, they slough off and the bacteria actually likes to eat what's called glycogen, which is in those cells. And that feeds our healthy lactobacillus. And so that keeps it going and protects us. And lactobacillus protects us by actually making the vagina very acidic. The pH of vagina is normally 3.5 to 4.5. And so it makes the vagina very acidic. And it also produces hydrogen peroxide, which chases away the bad bacteria. So now that as you're going through perimenopause and menopause, you don't have that estrogen. And so we're not making those thick cells. And now your cell layers are getting very, very thin and we're only a couple cell layers thick. And it's not sloughing off. And so the lactobacillus doesn't have any food. So the lactobacillus dies off. And now you're going to have a pH of the vagina closer to 5, 5.8, even higher. And then what ends up happening is now you have a perfect situation for these other bacteria to get in there. And people are always asking me, like, how's the bacteria getting there? Like, I clean. It's just bacteria that's around us. It's like picking up a cold. It just happens. We can't live in a bubble. And a lot of the bacteria actually comes from our gut because the rectum and the vagina and the urethra, the tube epithel is so close together.
Everything's connected. Yeah.
Yeah. Even if you're wiping properly, there's going to be bacteria from the rectum that's going to get into the vagina. And once these quote bad bacteria set themselves up, then it becomes, you're more susceptible to recurrent vaginitis and it becomes difficult to get rid of. You're much more susceptible to recurrent urinary tract infections. So unfortunately, during the perimenopausal and menopausal period, the nice thing is, yay, no more periods, but nobody gets the menopause memo that we have all these other issues that start during that time. So
sure. Yeah. So with a lot of my patients, to help improve that those problems, I do replace estrogen. And so we can kind of get into this conversation here, and I'll let you say your piece on this, but I like to not use Premarin or, synthetic forced urine on patients. I instead like to use estradiol, which is E2, or estriol, which is E3. It has to be compounded. But using an estrogen cream has worked wonders in my patients. It's strengthened their tissues so they aren't so frail. They don't have pain with intercourse. They're not getting the UTIs. They're not getting infections. So I have found replacing estrogen can be very helpful in many of these cases.
And are you talking about systemic replacement or vaginal?
So both. So
okay, good.
Yeah, so I offer patients both. Some patients honestly don't want to take systemic estrogen replacement, so we'll just give them a vaginal option. Some of my patients are like, bring on the estrogen. I need it for my memory and my bones and
yes.
my hot flashes and whatnot. So, and those patients who we are really optimizing estrogen levels in, they usually don't even need the vaginal option because their estrogen is higher because of the systemic replacement.
Yeah, so, medicine did a real disservice to women because, all right, so it started off when I first trained, it was like, everybody needs to be on hormones because it protects your heart and it's healthy and you need to be on it. And then all of a sudden they did this Women's Health Initiative study, and they stopped the study because there was a higher risk. And there's a lot of politics behind this study too, but there was potentially a higher risk of cancer and heart disease in the women that were taking both estrogen and progesterone together. So everybody, doctors included, got scared, and everyone was like, no hormones. And so for years, and we're still dealing with this aftermath. And this is, we're talking, oh my God, I was in training. So we're talking like maybe close to, I don't know if we're up to 20 years yet, but we got to be getting close to where this is like almost 20 years old now. But so people are so scared of the hormones. Mm-hmm. And the problem isn't the hormones, it's what type of hormones you're using. And so that's the problem. So the study was done on an older population that may have had those risks already. So, and then the other problem is they were using synthetic hormones in those studies.
Given orally also.
And the combination of estrogen and progesterone. Yep. But even though that's not bad, all the hormones that were used were synthetic. And we know that especially the synthetic estrogen, when it's broken down in the body, it makes these byproducts that we know are cancerous. So that they can trigger the genes to, trigger what's called oncogenes. So we know that they make this byproduct. So, and same thing with the progesterone. So when you're using these bioidentical hormones, which are hormones that are more geared toward your system, you don't get those byproducts. We also know that the synthetic hormones create inflammation, and we know inflammation can lead to a ton of different health conditions in the body. So yeah, I'm totally for the natural, the bioidentical hormones, not using the synthetic hormones. Though here's the thing though that's interesting. There actually are some bioidentical estrogens that are on the market.
Yeah.
So there are some. So, because then it was in the news, like, oh, compounded hormones, like they differ from batch to batch and from place to place. And yeah, that can be true, but that's why you go to a reputable pharmacy that does the compounding. And, what I like about the compounding is you can tweak the hormones as you go. But I know some people, because of sometimes the cost of the compounded ones are a little bit more, and sometimes some insurances don't cover it, but there are some natural prescription options too. But yeah, so there's systemic hormones you can take that go through your whole system. There's hormones that can be placed into the vagina that can either be compounded. I find that the two, and I'm going to badmouth two of them, there were two on the market vaginally for years. Premarin, which is derived from horse urine, and that has a lot of synthetic byproducts, and then estrace. And so over the years, I would get people here and there that'd be like, oh my God, it burns when I use those creams. It burns when I use a cream. Well, you know what? As I got more into functional medicine, I found out why. There's propylene glycol in those creams, which is very irritating to the mucosa, and something that we don't want in our creams or in our cosmetics. Or so that's why there's a bunch of different other options that don't contain that. There's ones that can be compounded. If someone's if someone's completely opposed to using a hormone in the vagina, then there's we've really made some leaps and bounds over the last couple of years. Probably since 2016, there's been the development of different kind of cosmetic. When we say cosmetic, they were derived from the cosmetic field with different lasers. So
talk about that.
Yeah, the lasers have been a game changer because yes, they are a big upfront cost, but long term, I actually did the math, they're cheaper than if you're filling your prescription for a lifetime. And so they took cosmetic lasers, which have been around since the 1980s, that we know that so a laser is just light energy, and the light energy penetrates the tissue. It's making a microscopic injury, which sounds terrible because there's no other way to say it, but it's making like a microscopic channel in the tissue. But that microscopic injury is triggering the body to go, oh, wait a minute, something's wrong. I need to heal it. So it sends in all these growth factors to heal. And what it actually ends up doing is you increase the blood flow to the tissue. It increases the healing capacity of the tissue, and the tissue regenerates. And this has been used cosmetically on people's faces since the 1980s. And then I wish I was the person who came up with this, but all of a sudden, in the United States, they were approved since 2016, but they were back in Europe. They had been around for much longer. Someone was like, all right, well, why don't I just make this into a vaginal probe, and it does the same thing. And that's what's been the game changer. It's a 5-minute procedure. You come in, you have your vagina lasered. Usually the treatments are 3 treatments to fully regenerate it. And some people need a little bit more, but you do a minimum of 3 treatments, and they're spaced anywhere from a month to 2 months apart. And that will last for about a year. And then it does wear off. Nothing's permanent because we can't stop the aging process. But then you come in just once a year and you get your kind of like your tune up, and you get another laser. So that's been wonderful. Then out of lasers, the industry just kind of exploded. Everyone's like, wait a minute, there's other things we can do to regenerate tissue. Let's apply it to the vagina. So there's a number of different companies that developed what's called radio frequency. And radio frequency uses sound waves to generate heat. And we know that when you heat tissue to a certain temperature, well, if we heat it too much, it damages it. But if we heat it just to a certain temperature, that it actually triggers a minor injury that triggers the body to want to heal and then thus regenerate. So we're tricking the body and using its healing properties in combination with heat. So there's radio frequency. And now there's also some home units that you can buy that uses red light therapy. And we're looking at the products like the V-Fit or the V-Fit Plus, which is a device that you use in the privacy of your own home. It has red light. We know that the wavelengths of red light penetrates tissue and causes tissue regeneration. And so this is something that you can use at home. I love that product, but I like to actually combine it on my patients. I'll combine, like, let's do like a laser, get the tissue really good, and then take your home device and keep it maintained with the home device. So it's so fun, and I love it because it gives us really a lot of options. And I think my goal is to try to find non-surgical safe options for people for their pelvic health. So
very interesting. Yeah, I've thought of bringing one of those on board to my practice, one of those lasers. It sounds like you're very much for them, and they've helped your patients.
They're wonderful. They're definitely worth it. Like I said, I know it is a big upfront expense, but I calculated how much people spend on their co-pays for those tubes of cream, and over like a lifetime, you actually end up. Yeah, I think it takes you like 2 years to break even.
Sure.
So, yeah. So
very interesting. And even the commercially available preparations for some patients can be very expensive. I mean, like you're alluding to the copays, they really can be. So we've talked about estrogen deficiency and correcting that. And we've talked about kind of laser to help your tissues, we'll say regenerate or heal. What about improving the microbiome? So we already talked a little bit about diet. Are there specific probiotics that you recommend? How can we nurture our microbiome to also improve our pelvic health?
So yeah, definitely. So we need to go back and support the gut in general. And you talked about dairy before. So foods that tend to throw up your gut microbiome in general are your glutens, your sugars and dairy. So those are your big three ones. So, because we can get the gut microbiome and a lot of the gut affects, if our gut's affected, it affects our hormones, it affects our immunity. So we actually, to keep the pelvis healthy, we need to actually support the gut. But then there's also just adding in certain foods that help to support vaginal health. It's not just like taking lactobacillus, and I get a lot of people like, oh, I eat that yogurt that's supposed to be really good for your gut, and I forgot the name, which is good because I don't need to be bad mouthing anybody's brands, but it's not just that. There are specific lactobacillus that are specific for women's health, and a lot of people hear acidophilus, and acidophilus is great. But there's also lactobacillus crispus, lactobacillus gasseri, lactobacillus rhamnosus, so and reuteri. And so those are the more healthy bacteria we can get into the vagina by getting into our diet, the better. So the nice thing is there are so many companies now that have women's brands of probiotics, so that you can find it so much easier. You look at the back and you can do it through supplements, or you can just do it through diet and just add more fermented foods. We've at our home been playing around with making some of our own fermented foods. I know now yogurt gets a little tricky because it is a dairy, but there is some thoughts that, if you can tolerate dairy, that yogurt may not be as bad. So I leave it up to the person with the yogurt. We've been making our own yogurt at home, which has been tons of fun. And I actually will take those women's vitamins, those probiotics, and when I make my my yogurt, I'll open one and put that in there, so I know that my yogurt actually even has some of those healthier those strains in it. But even like kimchi or sauerkrauts, or and you can find any of this stuff over the in the supermarket now, but you want to make sure you don't want to get like a sauerkraut that's been canned. You want to get one that you have to find in a refrigerated section that's, has live bacteria in it. And I love kombucha, which is fermented tea. So that's, that has a combination of both healthy bacteria and healthy yeasts.
Yep.
Yeah.
Which also can help with, just in general, preventing the urinary tract infections and just vaginitis, period.
Yes.
Are there other supplements that you recommend for urinary health, like to prevent infections? What else are your next top recommendations?
Sure. Cranberry is great. Now, but cranberry, there's a fine line with cranberry. So some people, the cranberry, because the acidity of the cranberry can actually irritate their bladder. So it's something you have to try. But if it doesn't bother you, cranberry supplements are great to take. I tend towards, even though there really isn't any kind of data out there, that there's data saying that cranberry can help, but we don't really know dosages. So the problem with cranberry juice is it tends not to be as concentrated, and there tends to be a lot of sugars. Yeah. So I tend to like with the cranberry capsules, and then people can either take them all the time, or a lot of women are susceptible to urinary tract infections after sexual intercourse.
Yep.
And so taking those supplements immediately after sex, and even for like a couple of days after, that's wonderful. D-mannose is a type of sugar that helps support, it's almost like a prebiotic, helps support the healthy bacteria. D-mannose too, now it's also, some people, it bothers them, because some people that have sensitivities to what's called the FODMAP sugars, there's a FODMAP diet that some people's intestines can't handle, like fructose. The FODMAP stands for like fructose, and there's all these different sugars. So some people, the D-mannose one may upset the gastrointestinal system and make them more gassy. But if not, D-mannose can be a life changer as something to take all the time for somebody that has recurrent urinary tract infections. Those in combination with probiotics are probably my top 3 that I love.
Yep, I would totally agree. That's what I recommend for my patients too. And I believe cranberry turns your urine more acidic, which is why you're saying some people can't tolerate it. But then in a more acidic environment, the bacteria can't survive. So that's how that works. Then D-mannose has properties as far as binding bacteria, so they don't bind to the bladder wall. So it is sticky like a sugar per se. So if it can bind the bacteria, and the bacteria can't bind to the wall, and you get rid of them, then yay, you're not getting the infection. So that's kind of my understanding of how D-mannose works. And I'm someone who is on a low FODMAP diet, who has fructose intolerance. So if you're wondering if you have that, if you don't tolerate any of the alls, the sorbitol, xylitol, mannitol, those sort of sugars, or the oses, the fructose, whatnot, you may not tolerate D-mannose as well. So, and you probably will know by trying it. But I would agree that D-mannose can be a lifesaver for many patients. I have a product that we use here called cystostatin. It's an orthomolecular-based product for patients who when they know an infection is coming on, or after intercourse, if they know I'm just prone to infections. It has some natural antibacterials. It has uva ursi in it as well.
It
has some natural diuretics to help you purge the infection. There's celery seed and their and dandelion, if I remember right, and then marshmallow, which is a demulcent. It's very soothing to the mucous membrane. So essentially helps soothe the urethral tract and get rid of any sort of bacteria so they don't climb up that tract and cause problems. So that's a lifesaver for many of my patients too. That's just an as needed.
The other thing is sometimes actually trying to get the vagina more acidic will actually even help. So using boric acid suppositories can be placed in the vagina. And, it used to be you couldn't find it or you had to have it compounded. Now, I mean, everywhere I look, there's a company that's coming out with their own version of boric acid suppositories. And I actually have used boric acid to treat, there's some infections, ureaplasm and mycoplasm, that are really super stubborn, and they get into the urinary tract, and they usually are harbored in the vagina. That they're really difficult to treat, and the antibiotics don't often work. But I found that 2 weeks of boric acid suppositories, by acidifying the vagina, will make it a hostile environment so that that ureaplasm and mycoplasm doesn't want to be around anymore, and it actually kind of rebalances things. So using some more natural ways to treat with it, because that's the thing is, like, people get these infections and now they go on antibiotics, and now we just threw off their gut microbiome, and now they're more susceptible to inflammation and more infections. So it's like, I am the doctor that does not like to do surgery and does not like to put people on antibiotics. If we can keep you off of antibiotics and keep you away from surgery, then I've done my job. So
I totally agree. I'm sorry, my voice is not the best here. For boric acid, also for younger women, many times I'll give that to them preceding their cycle if they know every single month before bleeding, I have these symptoms. We have to work on everything you've mentioned, like improving the microbiome and optimizing hormones, whatnot. But using boric acid, even in the days preceding the cycle, can many times help resolve those cyclical infections that patients feel like they're getting. And speaking, go ahead.
I'm sorry to interrupt. That goes again with pH, because the vagina wants to be acidic, but when you're cycling and getting the period, the blood is more basic, and so it throws off the pH of the vagina, and that's why some women are susceptible to yeast and bacteria right around their periods. Or I don't exactly understand why nature built us this way, but women's vaginas are very acidic. So 3.5 to 4.5, ideally, like if we can keep it around 4, we're happy. But men's semen is closer to pH of 7 or 8. So I don't know why we were built like that, but some women, because of sexual intercourse with men, that will throw off the pH of the vagina, and that's another reason why they're susceptible to recurrent vaginitis and recurrent bladder infections. So trying to acidify the vagina again, get those things, the cranberry, the D-mannose, the probiotics, like try to get things back in balance. So.
Yes. I do want to comment on 2 things since I have you here. I have to ask you, so also we talked a little bit about the aging population, but back to the younger population and just struggles that a lot of women like myself have experienced, includes conditions like endometriosis. And I thoroughly believe that everything you've said today, especially the diet change, can greatly improve those sort of pelvic health conditions also. Would you agree?
Yeah. What's really scary when we look at endometriosis? So endometriosis is where the lining of the uterus, instead of sloughing off every month with your period, for whatever reason, it goes kind of backwards, and we're an open system. So it goes back up through the uterus, out into the fallopian tubes and into your abdominal cavity, and starts growing on other areas. There's actually been some strange reports where it's gotten into the blood system and they've found it in people's lungs and other areas. I think is really scary is that I've seen that in combination with polycystic ovarian syndrome, where women make multiple ovarian cysts. Those two conditions, which can cause pelvic pain, they were common when I started training, but they have exploded in the last 10 years. And it's like, why are we seeing so many more cases of this? And why are women really suffering with these conditions? Some of the theories are in our inflammatory American diet. We do know that, what you eat. And if you're eating things that are inflaming you, that you're going to trigger inflammation in the body. And some people get arthritis. Some people get interstitial cystitis, which is a bladder inflammatory. Yeah. Some people get endometriosis. Some people get, these ovarian cysts. But the other thing I think is really scary is the amount of environmental estrogens and the plastics in our environment, or some of the endocrine disruptors. There's a lot of chemicals in our cleaning products, in our cosmetics, that actually disrupt our normal hormones, or tricks the body into thinking that these chemicals your body will perceive as an estrogen when it's not. And so we as a population as a whole are being exposed to so many more of these environmental toxins, and we're seeing a rise in these conditions like the endometriosis and the polycystic ovarian syndrome because of these things.
Totally agreed. I've done several episodes talking about endocrine disrupting chemicals. It's scary because they're everywhere, starting at a very young age with plastic in our baby toys and plastic, lined shower curtains. And, we eat out of ketchup. We have ketchup that comes from a plastic bottle. The plastic specifically, the fragrances are really impacting our hormones and can lead to these conditions. So I totally agree. I think those are the top two drivers of those sort of conditions, the inflammatory foods and then the toxic world we live in. The second thing I wanted to go back to and ask you about is your thoughts on oxalates. So you mentioned interstitial cystitis, and I do just now, and I have found in my patient population that sometimes oxalates even, foods that are healthy, we think are healthy, and they are for many people, can drive up conditions like interstitial cystitis. So do you want to briefly mention?
Yeah. So oxalates are these chemicals that are found mostly in your leafy greens. So we joke about it because I have a colleague that calls it killer kale. And I can tell you, clockwork, January and February, I will see the highest rates of kidney stones, interstitial cystitis flare-ups, and vulvodynia. So vulvodynia is pain in the vulvar area. And this is all from buildup of oxalates in your system. And why is it happening in January and February? Well, because
people are trying to
get
like
healthy. Me, we go on my New Year's resolution, I'm going to eat healthy, and people start eating more leafy greens. They start eating their kale. They put it in their smoothies. And, once again, it's not that you need to stop, but certain people are just more susceptible to these high oxalates, and they can cause kidney stones. They can cause inflammation. We're talking red, beefy, irritated inflammation in the bladder, in the vulvar area, in the vaginal area. And it can be seriously painful. So if you have those conditions, first thing you want to look at is, let me try cutting out these high oxalate foods and see if it makes a difference. So but every January, January to February is the oxalate season. So
very interesting. I'm glad to hear your opinion on that.
Yeah.
So tell us where listeners can find you. I know you have a podcast as well, so tell us about that.
Yeah, so you can find the podcast, Some of Your Parts podcast, on anywhere you listen to podcasts. But it's a women's wellness podcast where we just talk anything women's wellness, and really the focus is that you're greater than the sum of your parts, because you really can't separate. If you're having a vaginal issue like we've talked about today, we need to look at your diet. We need to look at other areas of the body. It's not just the pelvis, not just the vaginal issue. I also have a health summit coming up called the Happy Vagina Rally, and it's for perimenopausal and menopausal women. And we have 3 days of experts just talking all things vagina. You can follow me on Instagram, Facebook, all those things. Just look up Dr. Betsy Greenleaf. You'll find me. And then I have my website, drbetsygreenleaf.com, and my practice website, which is greenleafbewell.com, and our pelvic health store, which is pelvicfloorstore.com. So, and soon I'm working on a book. Soon to be coming is the Vagina Diet book. So
ooh, I like it.
It's coming. So
I like it a lot. Keep me posted on that. We'll post all the links to where listeners can connect with you in the show notes. So wonderful. I have 2 final questions for you. So one, I hear you have a free gift for our listeners. So
yes,
tell us what that is.
So I have a list of your top 10 pelvic health tips. So these are the top 10 secrets on how to keep your pelvis healthy. So we'll provide that to you, and it's a great resource.
Thank you. Thank you very much. And then lastly, what is your absolute top longevity tip?
I think that the biggest tip is we can't take our parts as separate. That if we're having symptoms someplace, and in my specialty in the pelvis, then we need to look elsewhere. And it's not just diet. And we didn't even talk about, you need to look at your sleep. You need to look at your hydration. You need to look at your stress levels. You need to look at your diet, and those are sound like easy answers, but really those are the keystones to your health and keeping your body healthy. So if you're having problems anywhere in the body, but in particular, from my standpoint, the pelvis, we really need to get those in balance first.
And finding a functional medicine practitioner, someone who has additional training, can help you identify that. Well, thank you, Dr. Greenleaf, for coming on the show today and reminding us of the importance of improving our many times neglected pelvic floor. So you're a wonderful guest. Thanks for coming on the show today.
Thank you so much. I really enjoyed it. It was such an honor to be here.